Now back to that story that we had earlier on, and the Council of Governors has raised concerns over what they have termed as a plot by the national government to revert the devolved health functions to Afya House. The governors are accusing the national government of deliberately sabotaging the devolved health functions, which is a clawback that is now quickly degenerating into a crisis as the counties face financial problems and lack of drugs.
The Council of Governors has put the national government on the spot for what it has termed as a deliberate move to sabotage health functions that were devolved to the county governments, a move that has disenfranchised residents in the 47 counties. Functions that have heavily been affected include primary healthcare delivery, engagement of community health promoters, and attempted establishment of primary care networks.
There is a crisis in the implementation of devolved health services due to deliberate steps by the Ministry of Health to claw back on the health function, thus derailing the gains made since 2013.
The functions of health that are already devolved, when the national government through the Ministry of Health tries to implement the same using development partners that are funding the Ministry of Health, then that is clawback. So on the issue of the primary care networks, on the issue of upscaling CHVs or CHBs, we would like the national government to use existing structures for the counties to be able to implement the same.
The governors have raised concern over the abrupt end of the Managed Equipment Service MES program without them being consulted.
The country is staring at a crisis, with over 121 health facilities grinding to a halt due to lack of maintenance and service of the equipment occasioned by the expiry of the MES contracts.
Most of the counties and our facilities have no drugs because we are stuck, because KEMSA, with what is happening there, does not have any supplies in stock. We are turning to private sector, private market, where the drugs are more expensive, and even the reliability of the same we cannot be guaranteed.
And with only 1.5 months to the end of this financial year, Treasury still owes the counties 94 billion shillings. And now fears of 100% absorption of the funds is another major headache for the governors. Vincent Odur, NTV.